Hi, my name is Dr. Peter Plantis, and I am the physician executive at Indianapolis-based HC1. And today I'm going to take you on a quick journey of what we learned through the COVID pandemic, how it spread across the United States, and what we're being able to use towards the CV-19 pandemic crisis. You saw all the articles came out, the newscast, everybody was expecting there would be local data. There wasn't data. HC1 moved into the forefront, and in terms of helping population health to make the right decisions of where they could reopen, where we had to use masks, where we had to use containment, brought a hyper-local approach, and in a very rapid deployment that won the Pandemic Response Hackathon Award, that the CV-19 Testing Dashboard Coalition brought together 20,000 ordering sites for laboratories that were doing the PCR test or the antibody test. One of the most important things that was happening is that we could trend the data over time, and we could also break it down by demographics of gender as well as age groups. So we could know in what age groups it was spreading faster over time. And we developed what we called our local risk index, or LRI, and we published that for every single one of the 3,007 counties, as well as the micro data units of subpopulations, like your local town in a county. But most importantly was the ability, as you see demonstrated here, the trend that occurred. And all those activities, you remember at Memorial Day, people going into swimming pools and parties, you watch the trend rate of the local risk index rise quickly. We also brought this all together into the Workforce Advisor platform that universities and employers could use across whether it was a national, regional, or local platform. For the employer and the university, the CV-19 Command Center brought all of these access points of data into one screen where you could segment whether it was to a floor within an office building, okay, or a floor within a dormitory. And all of this data sources, whether it was the digital information coming in off of the cell phones of the employees and students, or the test results from the laboratories, or the local risk index of people's home communities, all coming together into the central nervous system. But to the individual, their cell phone became the input of their daily symptoms that we all learned to check, as well as they would get the information of their testing. We brought all this together, and you see a hyperlink there at the bottom of this slide that you can use to get to a peer-reviewed article that is very well documented of all the COVID research, how it developed, and then how it applies so that we can close the gap on COVID, and what we've now learned that we could use those same techniques to go and look at how do we manage other disease states, diabetes, heart disease, kidney disease, bringing all those elements together in terms of the complex databases of big data and the ability of these massive computers now to do artificial intelligence and machine learning. But together, they bring what we like to call the precision health insight networks approach to healthcare. This is really the merging of three initiatives that are going hyperactive in the healthcare arena right now for population health, precision health, and digital health transformation. And when you merge all those together, you come to the Precision Health Insight Networks. HC1 has a large cloud-based platform for precision health. We've been able to develop a whole portfolio of precision diagnostic and precision prescribing opportunities to apply to a population and specific individuals. The one that I'm most excited about as a physician is the precision prescribing, which we can look at multiple drugs and how they interact together or against each other in drug-drug interactions, but more importantly, in terms of the patient's own genomics. And here we got a case of Nancy Morgan, a fictitious patient who's on 5 drugs, and we use the red, yellow, green to show whether in terms of the genomic or drug-drug interactions, it's safe or needs to be changed. So on this brief journey from COVID to healthcare today, which is precision insight based, see us at HC1. It's been a very fascinating year, and I think we have the tools now to go into the future. Thank you very much.